With restrictions for the most part lifted, what, if any, concerns should people have about COVID, travel, and holiday crowds? Joining us now with his insight on this and more, Singing River Health System's pulmonologist, Dr. Ijlal Babar. Thank you so much, Dr. Babar, for joining us. And before we talk about Memorial Day, let's talk about the hospitalizations, because from what I understand, you've been spending a little more time in the ICU recently. Does that mean numbers are slightly up in the hospital there?
Yeah, Karen, as opposed to like a couple of months ago where we had absolutely no one, now we're seeing people trickling into the ICU. And unfortunately, these are young people. We're seeing people in their 30s coming into the ICU. We have one individual on a ventilator who's only 30 years old. So it's out there, and it's beginning to take its toll.
Dr. Babar, on the vaccination front, one argument I've heard to try to convince people to go ahead and take it more seriously getting vaccinated is that if not, it's going to be more difficult to fight off any variants that may be around the corner. Do you agree with that?
I agree. I mean, I think the way that works, Dave, is that if you can get enough people immunized, then you don't give a foothold to the virus in your population. If you can prevent that foothold, then you can prevent mutants forming here and entering into this population. I think that's the way that works.
Yeah, and the vaccine rate's still very low in Mississippi and not really improving very much at all. Dr. Babar, you mentioned the 30-year-old on a ventilator. How much does it concern you going into a holiday like Memorial Day weekend with all of the restrictions dropped, so few people vaccinated, and a lot of young people who you're seeing in the hospital now are going to be out and about and in close contact with other large crowds, more than likely?
It worries me a lot. I hate to be the person who is in this situation where we've seen decreasing numbers to be still kind of talking about the dangers out there, but the fact is they are out there. And although we have only 2 people as opposed to 8 or 9 people 6 months ago in the ICU, these 2 people are valuable lives. And they really did not have any pre-existing diseases that would say that it's only a select number of people who are going to end up in our ICU. It's a small percentage, but it can land you in the ICU on the ventilator.
Yeah, well, not only young people, everybody's out and about right now. I mean, I don't know if you watched the PGA Championship this weekend, or some of the hockey playoff games, or you go to Walmart, or you go to the beach, you go anywhere. People of all ages are out and about.
Fortunately, though, the people above 50 have a much higher rate of vaccination, Dave, even down here in Mississippi. It's the people less than 50 who are not vaccinated that I'm especially concerned about.
All right, Dr. Ijlal Babar from Singing River Health System, a pulmonologist there. Thank you so much for getting us up to speed on things and for the great tips again.
Thank you for having me.